It was recognised quite early in the pandemic that a high proportion of SARS-CoV-2 infection were asymptomatic, but that what limited testing was available were only restricted to those that were symptomatic. So the COVSERO study was really designed to understand the proportion of the population that have been exposed to SARS-CoV-2 over time in an urban and a rural setting. This was a collaboration between the Malawi Epidemiology and Intervention Research Unit, MIRU, and the MRC University of Glasgow Centre for Virus Research. And I co-led this with Professor Mia Crampin and Abna Amoa. We were able to redeploy both field and laboratory staff to this study using their existing infrastructure and also their cohort.
My work involves testing the samples that we get sent over from Malawi to measure the amount of neutralising antibodies they have in them. These antibodies are able to bind to the SARS-CoV-2 virus, preventing it from entering our body's cells, and therefore are a good indicator of protective immunity the population has against future SARS-CoV-2 infection.
We're processing blood samples as well as the swabs. The blood samples, we're testing an in-house ELISA where RBD and S1 antigens were tested. We're also involved in PBMCs where we store the samples for further testing.
During the study, I was responsible for designing of the data collection tools and training materials for staff, identification of local suppliers for some of the study materials.
We basically found that the proportion of the population exposed to SARS-CoV-2 increased from around 26% to 89% in the rural setting and from 46% to 94% in the urban setting. And interestingly, the dynamics of infection were very different for different ages as well as different settings, with older age groups and also those in the urban setting having higher levels of infection. So we've reported these findings to both the Ministry of Health and the scientific community in Malawi, and hopefully these data have been used to inform vaccine policies going forward.